Let's get right to the director of the National Institute of Allergy and Infectious Diseases for now, and chief medical advisor to the president, Dr. Anthony Fauci. It's so good to have you back on the show. And Dr. Fauci, I'm going to put you to work again as we start this interview, because state officials are urging Americans to get vaccinated before gathering for the holidays as cases of COVID-19 are soaring nationwide. According to the CDC, 30,000 people currently in the hospital have tested positive for COVID, up 30% since Thanksgiving. And the average daily COVID death rate is now 426, a nearly 62% increase from last week. Health officials say the current triple-demic of rising COVID, flu, and RSV cases, along with an extended healthcare workforce, are pushing hospitals to the brink. Dr. Fauci, can you comment on this situation, especially on the hospitals and how they're coping with this triple-demic, and how people should look toward the holidays given these challenges we're seeing on three fronts?
Well, you've reported it accurately. We are seeing an uptick in cases, followed by an uptick in hospitalizations. And as you showed, there's a percentage, more than 60% increase in deaths. We have done much, much better recently than we had a year ago this time. If we were having this conversation, there would be literally hundreds and hundreds of thousands of cases and 3,000 to 4,000 deaths. We're down now to 300 to 400 a day, but that's not good. We still need to do much better than that. And the danger as we get into the colder months of the late fall and the early winter, superimposed upon the holiday season gathering, that's not a good combination. And that's the reason why we're telling people we have a good booster updated vaccine available, and we are not doing well enough in people getting vaccinated. We only have 68% of the total population vaccinated. About 50% of those have received a single booster, and only 13% of the eligible population for the updated boost have gotten boosted. We've got to do much better than that, particularly given what you said. We're getting cold weather, we're getting an uptick in cases, and we have the holiday season where people are congregating indoors. We have the wherewithal to do something about that, and that, I hope, is a call to people to realize how important it is to do that, to get vaccinated, to be careful, wear a mask where appropriate in indoor settings when you have a crowded situation, get tested when you congregate, for example, with family. It's very easy to get tested and show that you're negative before you go in and perhaps expose a vulnerable member of your family.
So I want to ask you about the specifics of the timing of getting a booster. So for some people, it's a third booster. For me, it would be a fourth booster. How long after having COVID? Or, for example, I got a text saying that you shouldn't get a mammogram soon after. You have to space that out. What are the things we need to know about getting that booster, and should everybody get boosted?
Well, certainly the answer to your last question, Mika, is yes, everyone should. And the timing is as follows. If you had been infected with COVID, you wait 3 months minimum to get a booster. If you have had a booster in the past, but not the updated one, the bivalent BA.4/5, you wait at least 2 months before you get the next shot. So that's the timing. That's easy. Things like avoiding a mammogram soon after you get a boost, that's really related to if you get a shot in the arm, you could have maybe an inflammation of the lymph nodes in the axilla there, and that's something you don't want to complicate the interpretation of a mammogram, but that's the only reason for that.
Dr. Fauci, good morning. Good to have you on with us. You've served 7 presidents, beginning with President Ronald Reagan, both Republicans and Democrats. Can you put into some context over your 40 years almost at the top of your organization what the last almost 3 years now have been like for you in comparison to the other crises that you've been through? Because there has been HIV/AIDS, of course, Zika, bird flu, the list goes on and on. Not just in terms of the disease and the numbers and everything we've seen in this country, more than 1 million people killed, but in terms of being the face of it and managing the information that comes out to the public.
Yeah. Yes, it's a great question, and it really has been very unique. You're right. I've had the opportunity to be able to be in the eye of the hurricane of multiple different outbreaks over the years, but they've been really quite different than COVID. With HIV, which is a serious pandemic, it's still ongoing. It was a smoldering, gradual over a period of time, extended now. We're in our 41st year of it. It was very mysterious in the beginning. It selectively, at first, involved individuals of certain groups, particularly men who have sex with men. And then we found out that globally it was really could affect anybody, particularly in the developing world. We've had blips with other. We've had Ebola, we've had Zika, we've had chikungunya, we've had pandemic flu of 2009. The unique nature of this is that it's 3 years of really essentially wearing down the country. This was hopefully in the beginning when it first came out, we thought we'd have a big blip of an outbreak and it would go away and we'd be done with it. And here we are going into the 3rd year of it, and we are still in the middle of a pandemic with the numbers that you just showed. That's completely unprecedented to have that amount of stress on the system, and the durability and the duration of the stress is extraordinary.
And as you look back, Dr. Fauci, now with 3 years of hindsight, part of science, as you know very well, is learning. Okay, maybe we got this right, maybe we got this wrong. I remember in the early days of the pandemic when we were all home and people were leaving their groceries in the garage because we thought it was contact with the cardboard boxes, all those things that turned out not to be true. We know now that children tolerated it much better than we thought, and schools probably didn't need to be closed as long as they were. What are some of the things you learned, or maybe even some regrets you have over the last 3 years?
Well, I think you said it very well. It has been a moving target, particularly in the early months going from January 2020 throughout the first year. You know, understanding the virus and how it transmitted and having to make recommendations in real time when you don't have all the information. And it's so easy and true. I mean, if we knew in January and early February the things that we learned over months and a year about the virus, we certainly would have done things differently. And that's really one of the things you have to deal with. You have to deal with the information you have and make your best judgment at the time. If that information changes, which certainly it did with COVID because it's been so dynamic in our understanding about the virus, then you have to make changes in things like your understanding, your recommendations, and your guidelines. And that's the reason why you saw things evolve much over the first year, and even to today, understanding the different variants, how they've evolved over the years.
It's amazing, Dr. Fauci, we still, 3 years on, don't know precisely how this started. You've said most of the research, the peer-reviewed research, shows that it was transmitted from a bat to an intermediary host and then to humans, starting a global pandemic. There are others who believe that it leaked out of a lab in China. You said you have an open mind to that. You just want to see the data. Why is it that we don't know? Because it strikes me as a really important point to know and to learn from for the future. Why is it 3 years on we don't know how this pandemic started?
Well, it's not that unusual. You know, the first COVID, remember, the SARS-CoV-1, it wasn't COVID then, it was called SARS-CoV-1. It took a while for us to nail down completely and unequivocally that in 2002, when we had that outbreak, it took us a while of a few years to figure out that it was a bat to a civet cat, which people take into the markets and then into the humans. So it's not that unusual to not know right now. The problem we have is that because of the tension between China and the United States right now, we don't have the opportunity to go and do the kind of surveillance with animals there, do serosurveillance to find out, was it the same sort of thing, which many of the evolutionary virologists in the peer-reviewed papers that I had mentioned that you just referred to feel strongly that it very likely was that. But we haven't nailed it down. It would be so much better if we had open transparency and communication, which is really a problem because there's a great deal of hostility now between China and the United States.
Well, and there's a lot of disinformation. Dr. Fauci wrote a guest essay for the New York Times looking back on your decades-long career in medical research, and it's your message to the next generation of scientists, and in it you reflect on disinformation about the COVID-19 pandemic. And you write in part, quote, the United States is reminded of the importance of continued investments in basic and clinical biomedical research. The major successes of the COVID-19 pandemic have been driven by scientific advances, particularly life-saving vaccines that were developed, proven safe and effective in clinical trials, and made available to the public within 1 year, an unprecedented feat. Other lessons are painful, such as the failures of certain public health responses domestically and globally. We must also acknowledge that our fight against COVID-19 has been hindered by the profound political divisiveness in our society in a way that we've never seen before. Decisions about public health measures, such as wearing masks and being vaccinated with highly effective and safe vaccines, have been influenced by disinformation and political ideology. It is our collective responsibility to ensure that public health policy decisions are driven by the best available data. Scientists and health workers can do their part by speaking up, including to new and old media sources, to share and explain in plain language the latest scientific findings, as well as what remains to be learned. And I guess my question to you out of that is, what happens if the disinformation is coming from the president you're working for in real time? What did you learn about what scientists need to do to step up and push back against disinformation?
Yeah, I mean, that is a difficult issue to address. And the only thing that we can do while maintaining people's freedom to say what they want to do is to really get out there and be very proactive in putting out science-based, evidence-based, data-based information, because it seems like the people who spread the disinformation are very energetic and seem to have nothing else to do but do that. So we've got to be out there, scientists and the general public and those who understand the facts, and get out there and talk about true and correct information, because disinformation is bad under any circumstances. When you inject it into a situation when you're in a public health crisis, disinformation can be the bane and the enemy of good public health practices. And we've seen that. And that's what I referred to in the article, an excerpt of which you just read, that it can be dangerous to the health of the nation when disinformation dissuades people from making use of what could be life-saving interventions like vaccinations, wearing a mask, and abiding by good public health practices. That would be horrible to see people suffer and die because of disinformation.